we'll just show the camera here. Jess doesn't have anything written on his little notepad. Jess, this is your patient assessment, medical, geriatric sepsis.
Okay.
You have 15 minutes to complete the skill sheet. You can start when you are ready.
Okay, I'm ready.
All right. You are dispatched to the nursing home for a 88-year-old female, altered mental status.
Okay. BSI, is my scene safe?
Your scene is safe.
All right. I am going to determine, is this my only patient?
It is your only patient.
All right. I am going to consider additional EMS resources. At this time, I don't think that's necessary. I'm going to go ahead and consider C-spine, but I don't think that's necessary at this time.
Okay.
Nature of illness is altered mental status. So then I'm going to go ahead and approach the patient.
Okay, you approach the patient. As you're walking into the room, the nurse meets you at the door. She says that the patient has been altered mental status for the last couple of days. She has a UTI.
Okay.
She's on an antibiotic for it, but she was doing okay for the last couple of days, and then it just became altered. They don't really know what's going on.
All right. So my general impression of this patient is poor, sudden change in altered mental status. So at this time, I'm going to look for any life threats. Do I find anything, any bleeding or anything?
No life threats.
All right. I'm going to go ahead and assess the patient's airways. Patient's airway patent.
It is patent. She's breathing kind of shallow, and it's about 18 times a minute.
18 times a minute. Okay. Good equal rise and fall of the chest.
Yes.
All right. At this time, I'm going to treat for shock. Cover my patient with a blanket and high flow oxygen.
Okay. You kind of smell in the room. It kind of smells like, that nursing home stale urine smell. You notice that she has a Foley catheter in. It's pretty yellow and cloudy.
Okay. How's my patient's skin color, temperature, condition?
Skin color is cold, or skin color is pale. She is cold to the touch.
Okay.
And diaphoretic.
Okay. What's a pulse?
She is rapid.
Rapid
and regular.
Okay. At this time, I'm going to go ahead and do my OPQRST and sample history.
Okay, so the nurse is there. She knows this patient pretty well. Onset was about 2 weeks ago. She got the UTI. The last couple of days she's been in bed, hasn't really been moving. She then became altered. She had been complaining of being cold for the last couple of days, and then all of a sudden when she became altered, she was hot.
Okay.
Really no severity for the patient. She hasn't really said anything to you yet.
Okay.
And then time has been altered mental for 3 days.
Okay. At this time, I'm going to have my partner get a full set of vitals, while my other partner is going to get 2 IVs at this time, at least 18 gauges.
Okay, 2 IVs, 18 gauge.
And I'm going to have...
Sorry, did you say sample?
Yes, sample.
Oh, sorry, I haven't given you that yet. She is allergic to. Signs and symptoms, sorry. She is altered, cold to the touch, kind of Solomon. Her allergies are penicillin and sulfa. She takes metoprolol and lisinopril for her high blood pressure.
Okay.
And AFib.
Okay, AFib.
And the nurse hasn't seen her really eat in the last couple of days.
Okay. I'm going to have my partner get a full set of vitals. What's her patient's blood pressure?
Blood pressure is 70/40.
Okay. Pulse.
Pulse is 115 and regular.
Respirations.
Rate is 20. Sorry, I said it before. It was 18.
18. Okay. And blood sugar?
Blood sugar is 100.
100. Okay. All right. I'm gonna have my partner get a cardiac monitor, and we're gonna. Like I said before, we already have high flow oxygen on this patient.
Okay, high flow oxygen.
I'm gonna go ahead and get some fluids going. LR 20 milliliters per kilogram.
Okay.
And we're gonna go ahead and get some norepi ready, and that would be I'm looking to get 8 micrograms per minute, and so a 250 bag of D5W with 4 milligrams of norepi in there, and then I'm going to titrate that to be at 8 drips per minute through the pump. And then I'm gonna go ahead and give some calcium, one gram of calcium, and be prepared to intubate at any time, and versus rapid transport. And I'm going to titrate and try to keep the patient's blood pressure at 90 systolic. And I think I'm done with this patient.
Is there anything else you'd like to add?
I'd reassess patient.
Okay. What are you going to reassess?
I'm looking at all my interventions, vitals after I've given the medications.
Okay, so would you like to know what her vitals are after the norepi push?
Yes.
Okay, her blood pressure is 100 systolic.
Okay.
Over 60.
Okay.
Her pulse rate is still rapid at 110. Her temperature, her skin is still cold.
Mm-hmm.
Respiratory rate is still at 18, and she is still altered.
Okay. All right. So I'm going to go ahead and make sure that I said this before, but cover my patient with a blanket and try to keep my patient warm. And I didn't say it before, but my field impression of this patient is cold sepsis. And yep, I'm going to keep that blood pressure at least 90 systolic and rapid transport. And then I'm done with this patient.
Okay.